Guys, listen up. Michael is up on the roof and acting strange.
Whoa, what's the situation?
Anshan, I think he's suffering from depression. Risha.
Hello everyone and welcome back to my channel. I'm Steph. I'm a mental health and a cosmetic nurse. Today I want to talk a little bit about depression. So it's a very important topic, very serious, but I hope you learned something new today. Actually, part of why I became a mental health nurse was to raise a bit of awareness about mental health and destigmatize these things for everyone. So just a bit of a disclaimer, if this is a bit triggering for you or if you're struggling to listen to this topic, please feel free to exit now and I'll see you in my next video. We all feel down and sad once in a while, and it's a normal part of a human experience. But if these feelings start to get in the way of you doing things like work, social connections, your hobbies, then it's probably worth thinking about. It might be something else. Sometimes we can get sad for no reason, or sometimes we can get sad because of something that happened to us. But if it gets in the way of your sleep, your appetite, work, your daily functioning and making decisions, you probably want to think about, is this something that's temporary or is this depression? According to psychiatric guidelines, if a person's experiencing 5 out of 9 symptoms and has been experiencing these for at least 2 weeks or more, then a diagnosis of depression might be indicated. In Australia, 1 in 7 people experience depression. So this is according to Beyond Blue, which is a mental health organization, and you can get all the information as well down below. And that's a lot of people in just this country alone. So not only does depression affect your mental health, but it also affects your physical health. And that's what we know from what we see and how we feel. The important thing to know is that depression is treatable. So it's very, very important that you reach out to your trusted support circle or professionals if you feel like you are struggling. So what exactly is depression? Depression is a common and serious mental health disorder that affects the way you think, you act, and the way you perceive the world. It can also affect the way you manage your day-to-day life and make decisions that we often think of as minor. Anyone can get depression, but a study found in 2023 that women are more likely to develop depression, twice as likely actually. And younger adults compared to older adults are also found to have a higher chance of experiencing depression. So symptoms can manifest differently in everyone. So it's not a one size fits all, just like our cosmetic procedures. And often people feel differently and perceive the world differently depending on who they are as individuals. Some symptoms can vary from mild to severe in intensity and can often have a different impact compared to someone else. Some common signs and symptoms of depression can include social withdrawal, so withdrawing from your social connections like with your family, with your friends. Isolation can often be such a big barrier to reaching out for support. If you're noticing that you're withdrawing a lot more from social connections and isolating yourself a lot more, it's probably worth thinking about what is going on for you at the moment and checking in with yourself and seeing if you do need to reach out for support. Losing interest in things you normally enjoy, so if you like gaming or dancing or even listening to music, if you feel like your mood has shifted and you're not getting the joy you used to with those things, think about it. Changes in your sleep, if you're sleeping too much and you're not getting up, you're staying in bed all day, or if you're sleeping too little and you're not getting enough sleep, those are very, very common signs of depression. Decrease in your energy levels and feeling tired and fatigued for no reason can also be an indication of an underlying issue. Inability to sit still or difficulty concentrating, making small decisions can also be a huge factor or a common sign that someone is struggling with depression. Of course, one of the big ones is feeling sad and empty and worthless and hopeless. Very, very serious and often quite difficult because all the thoughts are in your head, no way to get it out. So it's a very, very serious sign of depression. These types of thoughts can often resolve into thoughts of self-harm or suicide. Those things are very, very serious and should not be taken lightly. If you do have any thoughts about self-harm or dying, please reach out for support and know that there is help. So what are the types of depression? It's not just depression or major depressive disorder. There's actually a few different types, and people experience different types of depression depending on what stage of life they're in. So here are a few common ones that I'll talk about today. One type of depression is postnatal depression, which often happens around the first year of childbirth. So for mothers, the changes in the hormones, lack of sleep, and just an overall overwhelming feeling can often lead to postnatal depression. They can also experience antenatal depression, which happens before they give birth. They can also experience depression during the pregnancy. So please, if you're a mother or have someone who just became a mom, please offer your help and support to them. Seasonal affective disorder, also known as SAD, often around winter time. So it's a seasonal type of depression. You probably have heard of it. Some people call it the winter blues, where they feel more down and sad during the winter. Maybe it's because we're not getting enough sun, so no vitamin D. We're not getting out and about as much. We can't go to the beach, do any of those activities, which is fair enough. It's a very common one as well. One of the common types of depression is clinical depression or major depressive disorder. So this is what most people get diagnosed with. Symptoms can vary again in terms of what they experience, depending on who they are as an individual. Some other types of depression that I won't go into too much detail are bipolar disorder. This is when there is a big shift in mood and there is a difficulty regulating the mood. Another type of depression is psychotic depression. If you're a mental health nurse and have worked in the ward or community, you probably would have seen this presentation. It's very interesting, but also very difficult for the person. There's also some uncommon types like dysthymia, which is when depression has been occurring for the last 2 years or more. Imagine being depressed for that whole 2 years and just feeling negative and worthless and hopeless. It's very difficult for the person. So if you know someone with depression, it's important to have empathy and offer your support whenever they're ready to take up on it. It's the most important thing. So let's talk about causes of depression. Now, we don't exactly know how or what causes depression, but what we know is that there's a few different things linked to the development of depression. It can be due to a combination of factors like family history or your genetic disposition, personal life events and stresses, personality types, as well as changes in the brain or chemical imbalances, which we'll talk about in a little bit as well. Studies show that in twins, let's say, if one of them gets depression, the other has a 70% chance of developing depression as well. It's not to say that if your mom or your dad has depression that you'll also be diagnosed, but there is a higher chance that you will develop depression. Personality types and different personality types have a higher chance of developing depression. So if you're someone who has a higher negative self-talk or negative self-esteem, low confidence, perfectionistic traits, and tendency to worry or ruminate a lot more, it's actually a higher chance of having a diagnosis of depression. Again, this doesn't mean that if you are experiencing those things that you definitely have depression. So always chat to your health practitioner, doctor, psychologist if you would like to know if you have or is indicated in your life that you have a diagnosis of depression. Drug and alcohol use. So over 500,000 Australians have a diagnosis of depression and also suffer a substance use disorder. Often people with depression would lead to self-medicating with alcohol or drugs and all sorts of different things. This can actually worsen your symptoms and develop depression in a more downward trajectory. Life events or environmental factors, so trauma or stressful events in combination with the other symptoms we've discussed can often lead to the development of depression. Last thing is the changes in the brain. So chemical imbalances of mainly serotonin, dopamine, and norepinephrine can lead to the diagnosis of depression. So there you go. That is a brief overview of what depression is, types of depression and causes of depression. So thank you guys for watching. I hope you learned something new today. If you are someone who is struggling with your sad feelings or negative thoughts, please know that it is treatable, that there are services of support available to you, and I will link them down below. And thanks again for watching. If you like this video, please don't forget to comment, like, and subscribe, and I will see you in my next video. Bye!